Bonjour tout le monde. Good afternoon, everyone. So welcome to Frontier College National Forum on Literacy and Mental Health. We have a great turnout, already close to 350 people. 350 people. We have over 650 people who have registered. So thank you for joining us and merci de vous joindre à nous. So my name is Mélanie Valsin and I'm the new president and CEO of Frontier College. I would like to start by acknowledging that our work in Tiohtià:ke, Montreal, takes place on the unceded indigenous lands of the Kanien'kehá:ka Mohawk Nation. Kanien'kehá:ka is known as a gathering place for many First Nations, and we recognize the Kanien'kehá:ka as custodians of the lands and waters on which we gather today. We would like to also thank the Adult Learning, Literacy and Essential Skills Program of the Government of Canada for funding this forum. So before we get started and I introduce our host, I would like to outline a few housekeeping notes. First, I'm going to address our French audience now. Donc, pour les francophones et ceux qui aimeraient suivre le forum en français, tous les panélistes vont s'exprimer en anglais tout au long de l'événement. Donc, si vous aimeriez suivre l'événement en français, veuillez cliquer sur le bouton en bas à droite de votre écran qui dit « Interprétation » et ensuite, vous pouvez cliquer sur « Français », French, et ensuite sur « Mute Original Audio », donc éliminer la bande sonore originale anglaise. Merci. As we have live translation today, we will all do our best to slow down as we discuss. So just a little call to our panelists and hosts on that. So after the panel discussion, we will open it up for a question and answer period. So everyone today, all the participants have been muted. So if you have a question, you can type your question in the Q&A section at the bottom of your screen. Or if you have general comments, you can feel free to drop them in the chat as well. You can also email us all your questions and comments at literacy@frontiercollege.ca, or you can tweet them at Frontier College. So this year we're introducing something new. We are hosting special breakout sessions with the panelists after the event, so that we can give you an opportunity to ask questions directly to them or to continue a conversation with a specific panelist. So the breakout sessions will begin at 2:40, about 10 minutes after our closing remarks, which will happen at 2:30. And we will be done around 3:15 Eastern time, of course. These will be held in a Zoom meeting. So you will have to get out of this current Zoom meeting and re-log into or click on another link that has been assigned to the panelist of your choice. The Zoom links to the breakout rooms are located in the reminder email that you received this morning, but also at the end of the event, we'll place all the links to the other Zoom meetings or the panelist Zoom meetings in the chat. So you can have a look, choose which panelists you'd like to meet and discuss with, and just cut and paste or paste the link into a new browser. In each of those breakout sessions, there will be a Francophone, Francophone staff that will be able to help you if you want to express yourself in French or communicate in French during those sessions. You will have noticed that the forum is being recorded and it will be available on the National Forum website. We will send you a link in an email later on today or tomorrow. So if you want to watch it again, you will have the leisure to do so. And if you want to share it with anyone that you feel would be interested in viewing it, please do so. Feel free to do so. Only the panelists will be shown in the recording, and the breakout sessions, by the way, will not be recorded. So I think that's it about logistics. I think now it's time to dive into today's session. So first, I'd like to tell you a little bit about Frontier College. So Frontier College is a national literacy organization that was founded in 1899. We work with volunteers, partners, and communities to ensure that everyone has access to effective literacy-based learning that empowers them with the skills and confidence they need to succeed and achieve their dreams, whether it be at school, at work, or in life in general. So we offer, in order to do so, we offer free tutoring and mentoring to children, youth, and adults who need this extra support, again, to achieve their goals. And so why are we doing this work? Well, you might be surprised to hear that 1 Canadian out of 5 is facing serious literacy issues. And, you know, these issues are having a great impact on many aspects of people's lives, including, as we will discover today, on their mental health. So our national forum aims at exploring the link between literacy and mental health. You know, these are 2 quality of life factors. And studies indicate that improving literacy skills leads to better mental health. And so over the next hour, we will discuss the importance of this issue. So now I think it's about time to introduce you to our host, André Picard. André Picard. So André has been a great friend and colleague of Frontier College for quite some time. He is the health columnist at the Globe and Mail and the author of 6 best-selling books. In January 2020, André was one of the first reporters in Canada to write about the novel coronavirus and about the risks it presented. He has covered the pandemic continuously since then, and he's the perfect person to be our host for this National Forum on Literacy and Mental Health. So André, thank you very much for being our host today. And everyone, please welcome André Picard.
Merci beaucoup, Mélanie. C'est un plaisir. Thank you very much for the invitation to be here today. It's really a pleasure, especially as a longtime supporter of Frontier College, to join you. Like many people, I was recruited to volunteer to help out by the late, great Peter Zowski, a great supporter of literacy in Canada. So welcome everyone to the panel, Mental Health and Literacy. As you know all too well in this audience, the literacy landscape changed quite dramatically during the pandemic. It didn't become easier, obviously. Literacy is essential in a modern society, but arguably it became even more so during the pandemic. You needed basic reading and writing skills to be informed, sometimes quite advanced reading and writing skills, to keep yourself safe, to access government programs. Everything shifted online, which posed an additional challenge to many. And not just the reading part, but getting access to the technology, which is a key part of modern literacy programs. Schools were closed or operated remotely. Organizations that work with children and youth and adults to improve literacy skills had to reimagine their operations if they were able to operate at all. The pandemic was particularly hard on marginalized communities where language and literacy programs are particularly important. And these were also the groups hardest hit by COVID. So there was a double whammy there. In addition, COVID-19 had a dramatic impact on our mental health. The isolation, the stress, both economic and otherwise, took a real toll on many, many Canadians. So what's the link between literacy and mental health? In the reminder email you received this morning, there was a link to a report that talked about this in some depth, entitled Literacy and Mental Health. So part of the answer is there, but we're going to dig even deeper into some of these issues with our panel of experts. So I want to introduce each of them briefly, and if the technology works out, when I introduce them, they'll pop up on the screen and you'll see them. So let me start with Dr. Sharon Burey. She's a behavioral pediatrician in Tecumseh, Ontario. She's also an adjunct professor of pediatrics at Western University. Dr. Burey is a member of the Ontario Medical Association's Health Policy Committee and the immediate past president of the Pediatricians Alliance of Ontario. So Sharon, welcome. You just popped up on my screen. That's good news. So say hello, and we're looking forward to hearing from you today.
Hi, everyone. It's a pleasure to be with you.
Wonderful. So next up, let me introduce Olivia Ike Duncan. She's an Inuk advocate, educator, artist, and mother, originally from Kuujjuaq in the Nunavik region of Quebec. Her work focuses on decolonization, identity, language, and creating new relationships to pursue reconciliation in Quebec and Canada. So welcome, Olivia, to today's panel. Say hi to us.
All right. Nakukumik, Andre. Thank you so much, Andre. Olivia Ike Duncan, kutua me utunga inu yunga, tamanin mantra me lok tutunga din niasunga. So thank you so much, Frontier College and Andre and the team of amazing speakers we're going to have today for including me in this talk. I'm an Inuk woman originally from Kuujjuaq, now living in Montreal, pursuing post-secondary education, hoping to become a writer and an educator. So thank you so much for the invite, and I'm looking forward to the talks today.
Great, thank you. Next up, I'll introduce Andrew Johnson. He's the Manager of Patient and Family Education and Publications at the Center for Addiction and Mental Health, as we all know, CAMH. He's worked in the mental health field since 1997, collaborating with people with lived experience, clinicians, researchers, digital developers, librarians, and many others to produce accessible mental health information. So Andrew, welcome to the panel. And I think, oh, there I go. I see you now. Hi, welcome.
Thanks very much for having me.
Great. And last but not least, our final panelist, we have Jackie Garcia Navidad. She's the project manager in mental health at Carrefour Le Moutier. She also volunteers at Frontier College, where as a project manager in the mental health field, she hopes to raise awareness about the lack of access and resources and information. So we'll have a lot to talk about on all those topics. So welcome, Jackie, to our panel. Great. Give us a wave so you can hear us. Great, thank you.
Hi, everyone. Thanks for having me.
Okay, we can hear you. So we've done all that, very secretly done our testing of the technology along the way. So before we get started, just a little reminder, you heard about the format a moment ago, but never hurts to remind you a little bit of this. That my technology sometimes goes blank and I have to just talk, but it's back. So little reminder, I'm going to have the pleasure of asking questions to our panelists, which we've prepared ahead of time. You can put your questions in the Q&A box, the question and answer box below. And we're going to have a special question period later, but if I see stuff in passing, I'm going to, if it's really part of our conversation, I'm going to integrate it. So don't wait till the last second. What happens often in these panels is the 400 people attending ask a question with 1 minute to go, and we obviously don't get to them. So put them in as we go along, whatever pops into your mind, and we'll try and get to as many as possible. When we're done our chat, of course, you'll have the opportunity to go into breakout groups with each of our 4 experts, and they're going to stimulate you to want to go in those groups during our conversation. And a reminder, il y a de la traduction simultanée. Si les gens veulent suivre en français, pesez le bouton, cliquez sur le bouton en bas et vous pouvez écouter en français. There's also closed captioning, so you can read if you wish to as you go along, which is, of course, very appropriate for a Frontier College event. So I want to start really with the basics, you know, the topic of today's panel, and just ask, you know, what is the relationship between literacy skills and mental health, and why should we care about this stuff? So I think I'll start with you, Dr. Sharon Burry, if I could. What are your thoughts on this?
Again, just thank you so much for this opportunity to be part of the conversation on literacy and mental health. I would like to start with an encounter that would shape the rest of my career as a pediatrician. Early on in my career, while I was the co-lead for inpatient child psychiatry in my community, a school-aged child was admitted with a diagnosis of a suicidal attempt after trying to jump from a moving car on a busy express highway because they didn't want to go to school. Imagine the consequences if this attempt had been successful. It turned out, after we spoke with the family and contacted the school for school reports, and later, after the child was discharged, a psychological evaluation revealed a severe learning disorder. Of course, subsequently, the connection between reading difficulties and poor self-confidence and mental health challenges like anxiety and depression was solidified time and time again. And in fact, in my experience, because I see these kids every day, I took today off to be with you, but as late as yesterday, when these kids receive evidence-based reading instruction, their self-confidence improves, their literacy skills improve, and in fact, their mental health challenges subside, and I just don't happen to see them in my offices as often. So that I've been experiencing that my whole career. And so that's why I got involved with the Ontario Human Rights Commission, and I would give a shout out to their landmark historic report on evidence-based reading programs that they want to, have a systemic approach to this whole problem of literacy. I will just encourage everyone to look into that report, and I leave it, to the rest of the panelists to keep on going. I'll jump in when needed.
Great, that's a good start. If you have the ability, put in a link to that report so our viewers can click on it, and if not, we'll do that a little later before we do the breakout groups. So Andrew, I want to jump to you if I could. You work in the field of mental health. You do a lot of publications, getting information out. What's that link between mental health and literacy that's important?
Well, certainly the link between mental health and literacy is, multifaceted. As Dr. Burry pointed out, just having confidence and the ability to have some agency in the world through being able to read and to interact with language in an effective way is absolutely essential. And then if we dig a little bit further, imagine that you're going to a physician's office and you're asking for help, whether it be a mental health problem, a physical health problem, or what have you, to really understand what it is that you're being told, or to be able to go back home once you've been delivered some information, to be able to look at the available information that's out there. Perhaps you've been given a pamphlet, or you've been given instructions about how to follow a simple health procedure. Basic literacy is absolutely key. And without it, of course, the consequence is feeling out of control, of feeling anxious, of feeling not able to cope with whatever it is that you're facing. And, and then from there, the real onus on an organization like the Center for Addiction and Mental Health, which really prides itself in being effective communicators, is to communicate in ways that meet the needs of the people that we're communicating with, to use person-first language, to use simple, direct language, to help people feel that what they're going through is perhaps difficult, but is not so abnormal that they feel out of step with their world, and that they're not accepted, or they feel shame. These are all real barriers that one of the fundamental pieces is literacy as a starting point.
Great. And I hope we can come back to some of those issues of language later, because they are very important. And I just want to thank you, Sharon, in passing. I see you posted that link very quickly. That's great. Jackie Garcia Navidad, I want to again ask this basic question of you, the link between mental health and literacy. How do you see it in your daily work at Carrefour Le Moutier?
Well, I'd like to say that like a lot of people that we work with we have actually two fields. So we work in preventing mental health distress, but we also work with newcomers, so immigrants. And one of the main things that we have seen is actually being able to tell your story, having the space and having the words to be able to share what you've been through. And it has been proving that in the process of healing, in the process of just going through a psychological path to go over something, to get through your past, to get through a traumatic event that you encounter, you need to be able to tell that story, because that's how you get some emotions out. That's how you're able to process. So not only about being able to tell, but even to write it, because you actually get some distance from it, and you can actually look at it and really create like this review on it and be like, okay, so this is what happened, but how can I move forward? What can I do with this? And all those things required actually access to services, access to the language, to be able to share in the main language. If your main language is, for example, an Arabic language, Spanish, etc., and then you have to speak with someone that doesn't speak that language, it's already a big barrier. But imagine not just feeling powerless because you can't share what you need to share in that moment. So I feel like it's really about empowering those people. It's about also giving them the tools. That's something that we work very hard. It's to give them back their power. It's for them to realize that we're going to give them the tools to be able to have a better level of literacy, to be able to then get better on their own mental health self-care.
Yeah, that's a great message. The literacy is empowerment message is a really important one to get across, and we'll talk about that some more today. Olivia Ike Duncan, I want to ask you about that basic question, and maybe you can address it. We know the Inuit community has very high rates of mental illness and suicide, lower rates of literacy than the mainstream population. Can you talk about those links and how we can tackle them?
So, as we all know, we Inuit have the highest rates of suicide in the world. And this is due to many factors, including colonization, shame, all of that. We're facing a lot of addictions. We have an extremely high rate of dropping out of high school. And these are because of the lack of connection and meaning that Jackie brought up. When you come from a different culture and you speak a different language, and you don't fit into this norm, you become to detach from the world, and you become to detach from yourself because you can't fit in. And I feel like that's what a lot of my people and Indigenous people and immigrants are going through. Coming to a different country, or I grew up north, so me coming to Montreal, it was a complete culture shock for me. I needed an immigration agent, and I'm from Quebec, and my people are facing 3 languages. So since I was a child, I speak 3 languages. I speak Inuktitut, English, and French, but I came from a privileged background because of the way that I look. So I was treated differently by teachers, and so there's a lot of factors that play into education and how that makes a person feel whole, and accessing those opportunities which we do not get a lot of access to because of the disconnect for language, the disconnect of realities, programming that doesn't fit in my communities, So helping people understand, when you come to my communities, when you are helping my communities, you have to understand the reality. Even though you have $1 million project with the amazing teachers and scientists, and it's all peer reviewed and fact checked, it will not work back home. So giving us space as Indigenous peoples, as people that know the reality of how mental health, how we can be as a community together is very important. And Frontier College does amazing work back home with my Inukhatiks, my children, building confidence and showing education in a different way, because educational facilities and these things have traumatized our people. So we have to look at literacy and education in a different way and bring in those Indigenous perspectives.
Great. I think a really important perspective to underline that literacy programs, education has to be culturally appropriate. It's just not about words on a page. It's the context. So, and hopefully we'll talk about that more today as well. So I want to ask about, I've been, as you heard in the introduction, I've kind of been obsessed with COVID for almost 3 years now. So I want to talk about that elephant in the room. I want to ask you, a couple of you, briefly about how were literacy skills adversely affected during COVID? What did you see practically? Maybe Sharon, you can start us on that. How did it affect the kids you treat?
Yeah, it was like day and night, March, I forget if it was somewhere in the middle of around March break, that the mandatory lockdown occurred.
March 11th, 2020.
March 11th, thank you. And I was fortunate that I already had an electronic medical record, which was in the cloud. So it didn't really affect, I had my charts, and because of the type of practice, I was literally able to go virtually from the next day. And maybe I have a busy practice, but what that probably caused, I was extremely busy during the pandemic because I was available and I was able to provide care. It was such a, and part of my role as president of the Pediatricians Alliance of Ontario was again advocating for school reopening and that sort of thing. But what the kids and parents, and I have to say the parents, you know, many parents were just, especially mothers, in fact, who literally had to stay home to look after their children. The children were disconnected. They were happy for the very beginning, but but it became such a very unstructured time. They were missing their friends, disconnected. Just having online work was, you saw a lot of attentional issues, exacerbated behavioral problems. And of course, later on, we had depression, suicide, hanging attempts. I tell you, it was very traumatizing for the caregiver, for the professionals looking after these kids because of the overdoses and the constant level of stress that happened because of the pandemic. Fortunately, now at this stage where we have in-person classes, I have to say that it has improved significantly the level of stress, both for families and for kids. And of course, you know, the internet connectivity, broadband, we'll talk about that. That was a huge issue for many kids. I remember seeing a family who had one cell phone and they had 5 kids. And I was able to connect on the cell phone, but no work could be done. The school was supposed to give extra devices as well as internet, but of course, you know, the implementation of these things is very difficult. But it was very difficult, and I'm glad that we're at a spot where kids can be in school, where it's an essential service for kids, and I'm happy that that is happening. Long-winded, but that's it.
No, very thorough. Thank you. Jackie, you work with communities, with clients, from many of whom are essential workers, frontline workers who really had a lot of pressure on them during COVID. How did you see the impact of the pandemic on the people you work with?
I wasn't working in the mental health. I was working with the youth at that time. What we saw was just how actually, like Dr. Burry said it, just how the line became blurry and how like everything started piling up. So when you're in a house, you're a teenager, you don't have this bubble, you don't have your group to which you identify, you have hobbies with, and maybe even you can escape from some reality. They were just stuck at home and they were seeing the issues. I was with the youth, and some of the parents, they both lost their job at the same time because they weren't essential workers. And then there are 4 children in the house that are trying to get through school, through like problems with internet and everything, and like being 4 at the same time and in the same living room trying to listen, and having their parents being worried about money, being worried about, oh, we need to find a food bank because we can't afford, we're about to lose the home. I heard some horrific stories. And not only that, I worked in the past in create communities, and I'm still very connected to the one I used to work with, and it was Swampy. And I heard heartbreaking stories. The community is so bound together. And one of the reasons why they're so resilient is because they come together when they have such a big issue. And then the pandemic got through it, and it was horrible because they didn't have access to any medical attention. The hospitals are hours away. You can't get into a hospital. It's not even that you're going to get into the emergency room in the next 24 hours. There is no hospital right there. So the community, they had to be really careful. And when your biggest support is your mother, and that woman can't get close to your house when she lives across the street, but it is to prevent her life, it is heartbreaking for them. It was so intense. And I heard such stories that were so hurtful. And how do you want to keep those kids learning when they're in those environments that they see everyone suffering, and then they have to cope, and then they have to understand that this is not a normal time. You can't go to the park, you can't be outside, you can't go play with your friend, your cousin, your brother, because he lives with his grandparents. So how do you bond all those things together? Have I seen some amazing work come in? Yes, we started back as volunteer our French classes online because the group was really thrilling and willing to keep going because they wanted it to be together. But more than just learning French, it was about just feeling that they were with people they knew, and they were understanding that, hey, we're going through the same thing, and first and foremost, we're going to support each other because this is what's going to help us get through it.
Yeah, that rupture of family ties, I think, had much more of an impact than we may realize. Olivia, I've had the pleasure of going to many communities in northern Quebec, Kuujjuaq, Kansajuliaq, Povednatuck, etc. These are beautiful places, but they don't have great internet. I sort of have withdrawal when I go there. This was, I assume, exacerbated by COVID-19 when we were expected to do many more things online.
We're still feeling the effects of those today, because when COVID hit, we realized we were not prepared. We do not have the facilities, the medical personnel that we need. So our communities were locked down. We could not let anybody in and not let anybody out. And like Jackie was speaking, family is most important in our culture. So it was very hard for our communities. But the schools, we don't have good infrastructure to begin with. So COVID was just another wrench in what we're trying to do. We're trying to, we have teacher training for Inuktitut teachers to become certified, to teach our language. All of these things were paused, and it is affecting our children right now. We have a big lack of educators in our communities, because a lot of them were locked into our communities. The teachers couldn't go home for COVID. It was kind of crazy. And in the end, we don't have iPhones, cell phone service. We do not have Wi-Fi everywhere. So our kids didn't have education for the past 2 years. To really be honest, we were not online schooling. We barely, teachers would walk around and go house to house delivering paper packages of work, but there was no way to follow up with that student unless it was by telephone, which most of my community members, we have an extreme, we're in poverty. So most of my people don't even have a telephone. So how to communicate with your teacher was hard. And we have been advocating for better access to internet, better pricing for internet also, because we have extreme high costs of living. The internet, even though it's probably the world's worst internet, it's probably the world's most expensive internet.
Not a good combination. No.
Yeah. So there was a lot of ways that COVID had hit us. We were unprepared for that. We had to send Red Cross in at one point to our communities. So, but we are still feeling the effects. The Western world, our cities, they're starting to get back. They're starting to open up, and we're doing hybrid versions of education now. But us, we're still trying to pick up the pieces. My children are still not being able to go into school because we don't have the internet sources. We don't have the teachers because COVID shut down. They were unable to get their training to be certified. So many different avenues how COVID affected our youth, our education, and our communities. But I think it woke us up to see what we need to do to prepare if this does happen again, and especially with the global climate. This is also another issue that we're facing. and we're not prepared. There is no literature, there is no plan for, we got a global lockdown, but what are we going to happen if we have a flood, if we have a natural disaster? I have no idea. So we're just always preparing for the next wave. I always say, like, I'm sick of being called resilient. You know, they're always like, we're so resilient, but why are you so proud of somebody that just keeps getting knocked down and we just keep getting up? But that's why we're here today. Our ancestors had survived all of that. So that's why we get up, and I'm trying to make a mash between the Western world and our cultural values, and, you know, and bring the world to an understanding, and bring my children, Inuit children, to the same level. Every child matters. My cousins, my nieces and nephews, they matter. So I try to bring that human aspect, and I have a privilege. I have a white privilege. My hair, my skin has a different privilege in the city that I walk in. So I kind of, you know, I try to fit in all of these worlds, but I'm trying to build bridges and give out a reaching hand to help each other. So these platforms are amazing to share our realities. So
great, thank you. And remind people there's a rich discussion going on in the chat function as well. So keep up, that's a good sidebar. I know in modern life, we can never do one thing at once, so we can have that chat and listen at the same time. Andrew, I want to come back to you with that question. Obviously, we saw a massive rise in mental health issues during the pandemic that affected CAMH. But how did it affect you on the communication, the literacy, information side particularly?
One of the things that we were really charged with is trying to reach out to our communities just around the vaccine and basic vaccine information. You know, there's historical reasons that people with mental health challenges are sometimes distrustful of the medical system, and really trying to put forward very factual information that would meet all of the needs, including answering, you know, really pressing questions that folks might have about, for instance, what are the interactions between, you know, the medications that I'm currently on that are helping me keep an even keel, and the vaccines that are out there. And also really helping to, you know, provide people with just assurances around the kinds of information that they're receiving, because, you know, as we all know, we were not just communicating to our end users, our patients, or their families, but also combating misinformation that was in the community, which was incredibly challenging. And, you know, really trying to lean on the reputation of organizations like Center for Addiction Mental Health, or, you know, any of the other folks who are really putting out really high quality information. And so there was not just the challenges around literacy or health literacy, but there's also basic digital literacy issues that were at play. That is, how do you critically assess the kinds of information that are being put out? Because it all looks so good, and boy, if I read it, it must be right. And trying to counter some of that. So all of that was challenging, and then to do it in multiple languages. You know, I work out of the city of Toronto, which is an incredibly multicultural place that has multiple languages at play, and trying to put it all out in up to 10 plus languages to at least try to address some of the those gaps that we're facing. So these were all things that we were working at throughout that time.
Yeah, good reminder, basic literacy isn't enough anymore, you know, reading and writing, but you have to have scientific literacy, digital literacy, figure out what's true and what isn't. And we did have a pandemic of COVID-19, but we also had this pandemic of misinformation that's going to impact society for many years to come. So I want to talk about, you know, post-pandemic. We're not quite there, but we have all these recovery programs. The government has invested in all kinds of efforts. But I want to ask you all, are we investing enough in the literacy part, in the mental health part, post-COVID? Maybe Andrew, for variety, I'll go with you to start this one off. What should the government be doing now to help out, to make up for this lost time from these last 2-3 years?
Well, we're certainly seeing some investments within mental health and particularly targeting literacy. There was a recent call around just basic digital literacy to help support Canadians who do not have basic digital literacy to gain that. And this is part and parcel of literacy. You can't really pull these things apart that effectively. That to me is a really positive kind of initiative. You know, we're always hoping to get greater funding to help support the number of clinicians that we have available. Everyone's very aware of the crisis within healthcare human resources, the fact that we don't have enough nurses to be able to treat our patients. These are the kinds of investments that we require in a very practical way. And then we need to be really thoughtful and open-minded about exactly how we invest in literacy. And I'll just tell one quick anecdote. We run something called the Collaborative Learning College at CAMH, which is a recovery college. It's a college that's meant for people who've come out of hospital and are really trying to think about what's next in life. Am I going to go back to work? Am I going to connect with my family? Am I going to do a whole bunch of things? One of the things that has been a really important barometer for us is every time we put up a creative writing course, such as poetry, it gets a gigantic waiting list, which tells me that everyone is really, we haven't become post-literate. As a society, people still value language and expression, and they see it within the context of mental health. That is, to tell my story. I think it was Jackie who talked about, you know, telling your own story earlier. You know, these are really effective ways to process your emotions, your thoughts, to communicate with others and to feel yourself within a community. You know, it's not enough to just invest in, you know, pharmaceuticals and all kinds of other things, which are very important, but really seeing these linkages between how we express ourselves and our ability to maintain and in fact enhance our mental health is absolutely essential.
Yeah, I think communication arguably has become more important than ever in our digital shrinking world, and giving people basic skills is really more important than ever. So Jackie, I want to ask you that same question. What should the government be doing? What kind of help do you need, particularly post-pandemic, to address, to make up for these losses of literacy and mental health that we've seen over the last few years?
I feel like first and foremost, we have to be thinking about more a long-term thing than a short-term thing. As you were saying, Andre, I feel like people think we're in a post-pandemic world. I feel like we're in a post-pandemic sanitary crisis. Like, we've gone through it, we've ended it, but the effect of what we've gone through, they're going to be here for a long time. And I would say, because it's mainly the work that I'm doing, it's about connection. It's about community. It's about getting people to heal by themselves and for themselves. So give them the tools, give them more information about mental health and so many things, like understanding and reinforcing that your well-being is part of that mental health. Taking care of yourself, feeling better, learning more, having more information, just to understand what you're going through is going to make such a big difference. Yes, we've been working on translating some information, but more than translating, there's people that can't read. So what are we doing about those things? Are we giving more access to translators in the schools? Are we reinforcing also the fact that we need to be sharing more of this information way earlier on, since they're kids, because those kids are going to grow up with having those information. Those kids are bringing back that information in their household and they're sharing. They're coming back home and they're like, Mom, I've heard this, I did this, it made me feel good. They made me talk about my emotion. I feel angry, I feel this. They taught me to write about my emotions. Now I feel like I can do it. And it's again about all the sense of empowerment and just feeling like you can do it. When you feel like you can do it, you get hope and you get to see the amount of possibilities that are in front of you. So I feel like it's really about reinforcing really small things. As Andrew was saying, it's not just about giving more money into the health system and pharmaceutical one. Yes, of course, it's extremely important, but it's not everyone that needs medication. It's not everyone that needs to get into like a proper mental health program. People need tools, concrete tools, simple, that can use, that they can apply, and it can be like, oh, now that I'm able to look at how I feel every day, I am more mindful of it, and I know that when it's going a bit downfall, I can do something. So it's more about seeing it in a day-to-day basis, but over a longer period, not just being, oh, we're going to implement this because for now it's going to work. It needs to be something that is going to last. And I feel like education is exactly the right place where we should really start.
Great. Just a reminder to the audience, there's still time to get your questions in the Q&A. There's only a couple of people who haven't been shy so far, so get the questions in. Again, really good, rich discussion going on, especially some good links to poetry programs, particularly one by the great Bill Bissett. So make sure you read the chat. Now, Sharon, I want to come back to you. You're a clinician, you're seeing kids who need help. The waiting lists are interminable across Canada. How can we make sure that we get help to kids who need it with their mental health issues, with literacy? What does the government need to do to help people like you out?
Mm-hmm. Well, I think I'll go back to that report because it called for systemic changes from the Ministry of Education in terms of curriculum design and also the faculties of education and how kids learn to read. And actually in Ontario, they have announced some funding for this program so that if there's a systematic and systemic overhaul of how we teach kids to learn, universal screening from kindergarten to know when kids are having difficulties with phonemic awareness. And you don't have to wait until grade 3, 5, or 6 by saying, oh, you're going to grow out of it, it's going to get better. We now have science-based methods, I'm talking about kids now, for teaching kids to read early on that have been proven. And if instituted on a systemic and systematic basis, they work. The research is overwhelming. What I find as a clinician, and I in my community, and there are about three school boards, it differs within the school board about what services kids get when they're when they need help. And so the call is for this systematic changes, both curriculum, training, and for testing and evidence-based programs. So I think right now that's what I would like as a pediatrician. The other thing is collaborative care. There have been many reports that have talked about, the multiplier effect of collaborative care. So that if you work in a team with maybe a social worker, nurse practitioner, the bang for the buck seeing a physician is multiplied. And we've called for, some school-based clinics that could be helpful, but in a collaborative method, because actually there are silos that are present in all the systems that we have, and they're not talking to each other and not collaborating. So that's another big ask. So I think those are two things. And of course, I also think that there are smaller organizations, more local organizations who are close to the problem, who have the reach, like we talked about in the pandemic, where we had to go to the indigenous leaders, to the Black leaders, the different leaders in these communities or these smaller organizations, to make sure that they have the funding and build some capacity, so that this type of misinformation that Andrew was talking about, and all of us, if we had the connection to these communities, that would help significantly.
Yeah, and good points about there's a lot of inequity. Not everybody needs the same services. A one size fits all certainly doesn't work either in mental health or literacy. Olivia, we talked a little earlier, you talked about some of the needs up there, particularly better internet, access to computer equipment, better schools. What else would you like to see post-pandemic that would really help to advance the cause of literacy and to address mental health issues in the North?
I spoke a bit about it earlier. The colonial history of Canada, of Quebec, has extreme impacts on our people. My grandparents were residential school survivors. That's as much as we know. We don't know where. But we've heard the stories, and I didn't think it had anything to do with my life or my journey, but learning about it really changed who I am as an Inuk woman, because we have high rates of suicide, high rates of alcohol, high rates of youth protection, high rates of dropout. I never wanted to identify as an Inuk woman. I was ashamed for many years, and these are things that were given to my grandmother and passed down without me realizing. And I think our people are starting to wake up and take back their pride. And we have to work with non-Indigenous, non-Inuit. It is our reality, but we have to create better relationships. Reconciliation is not just a word we have to use, and allowing us to take up those spaces. So I'm in college right now. And I'm kind of having a hard time fitting into those boxes of having peer-reviewed, fact-checked, scientific, because my elders are scientists and they're doctors, but my teacher and the academic world will not recognize them as fact-checked. So the way we look at education, the way we look at literacy really needs to be, is it really universal? Is it, and these cultural aspects, my culture, we don't have written language. The only reason why we have written language is because Europeans wanted to translate the Bible for us. So in order to convince us to join a religion, you have to create ways to share that in a different culture. So our cultures are really storytelling, imagery, and building with myths and legends and these stuff. So education for the Western culture and education for us is very different, but we have been sitting in classrooms, raising our hands, and we've participated. But now we want to participate in creating curriculum, because for thousands of years we have survived on the land, and we can share with the rest of the world how to be one with the planet. Because even if we have all the studied, peer-reviewed, fact-checked reports about the global climate and what's going on around the world, no amount of money will stop what's going to happen unless we really listen to the indigenous people and listen to Mother Earth. So being understanding and being open and giving us the space. You know, we want to sit in those boardrooms and help make decisions. We want to create curriculum for Canadians, for Quebecois. We want to share our story because that's the only reason why we would want to be alive, is to have our story shared and to feel like we were a part of something. So the governments, the big businesses, they have to give us space and they have to allow us. And it's very hard discussions that we're having. It's, you know, where a lot had happened back in the day. So it's not fun to talk about the past and the history. But, you know, in my culture, our youth group is named Hakdreet, which means it's a bow and arrow. And it's in a metaphor that we say, in order to go forward, we have to go back. And we lost a lot from the back. So I'm trying to go back, and my grandparents are not with us anymore due to suicide. I lost my grandparents to suicide. They were residential school survivors. My grandmother was a hidden child who never got taken. So there's both of those sides, and understanding that and allowing us to share that and to feel that is, I think, one of the first steps. It's not about funding. It's really about creating empathy and a human connection before you can even offer literacy or anything else.
Yeah, dealing with that intergenerational trauma and the impacts that it's had is going to be an important part of reconciliation. So I want to wade into, there's some really good audience questions. Some of them I'm going to smudge together because they're similar. I want to start with one. There's a lot of interest in, you're all very powerful advocates, all very literate and speak very well, and people are looking for some advice. How do you raise awareness about issues like literacy and mental health, and how do you do it to be impactful with governments? Jackie, maybe you could start us off. How do you get the messages across? How do you become a good spokesperson like you?
You talk about it. That's first and foremost, you talk about it. And I'd say also, it was something I was thinking also about when Olivia was talking about the reality related to intergenerational trauma and literacy. And one of the things that came to my mind is exactly that, is people of our, like, I'm a person of color. Both of my parents are from El Salvador. And I feel like I have the privileges to have been really sensitive to those issues and to have looked into it and to talk about it. And because I am a Latina woman, it does touch the Latino community. So it is also just to doing the work and to be able to speak up, to be able to talk about it, that yes, there is some issues. There is issues related to immigration. There is issues related to mental health. There's a lot of issues related to literacy, and just being able to talk about it and do the small things. Start volunteering, start looking at it. Go to the community center that is right across the street. Go ask them, what are the problems? What do they do? How many volunteers do they have? Do they need help? Just go walk around literally your neighborhood and see what's around, because that's how you're going to see that there's a lot of things that we don't see around us, because we are in our daily basis doing our own thing. And if you just stop and you're like, well, I have never exposed myself to this. I would say, like, raising awareness is really about doing the smallest thing you can do. Open that article that you have meant to read and you've been keeping it right next to you, but it's on top of the pile, but you're like, tomorrow it's going to be done. Do it. Just take the 5 minutes it takes to, like, literally just read the underline and just get curious, really get curious, because that's how you're going to open yourself up to a lot of issues. Talk to people that have different perspective, like we are doing now, because we are, and even the audience, it's amazing that you're exposing yourself to, like, different points of view, because you're going to get different angles, and then you can go look to those issues that you haven't seen before, to those angles that maybe you never you never thought about it. And that's actually how you can seek new solutions. That's how you get creative.
And Andrew, you work in this field of getting information out, communication. How do you do that effectively? How do you make sure you're going to have an influence and you're not just tossing words into the wind?
Well, you know, one of the things that that is important for us is to really, you know, you were asking earlier about what are the effects of COVID, and you know, we talked about a lot of the challenges, but I'll say that one of the positive effects of COVID and the aftermath is opening up the space for conversation about mental health. There's more discussion about our mental health, open discussion about suicide, suicidality, anxiety, school refusal, all of it. And I think that we should look at this as a gift. Insofar as these things were all here before COVID. Did COVID exacerbate all of those things? Absolutely. But now we need to turn around and encourage people to open up those conversations. And, you know, to do so in ways that are really kind of locally responsive, individually responsive. Olivia was talking about, you know, having people in her community not being recognized and becoming really disengaged because of that. You know, the more that we focus in on helping people to define the issues and to look for solutions that work for them, sometimes in you know, combination with other kinds of experts, that is a great first step. But that first piece of listening, and then all of a sudden this becomes intrinsically motivated. That is from the inside. I want to know. I want to be curious. I need to find out more because my community is now looking to me. And then organizations like CAMH can come in and just provide dispassionate information that's around a lot of really tough topics. You know, people don't necessarily want to read about opioid addiction or suicide or a whole bunch of other really hard things. They do so when they need to. And our job is to do it in as simple, inviting, non-stigmatizing. We don't need to wave our fingers at people. We don't need to blame people. We just need to help support them through strengths-based information. That is, you've now opened this book. Congratulations. Now let's start to build on that first move and then to provide the kinds of information that they need. And they also need it multifaceted. We want to be able to meet their needs in a bunch of different ways. Brochures, booklets, come and ask us questions, look at a webinar. There's no one size fits all in this space. And that's challenging, but I think it's really part of our job to help close that information gap.
Great. Sharon, this is, I think, a really important question. I'll throw it your way. We're being asked, what's the importance and the role of family and community in dealing with literacy and mental health?
I mean, that's where all the action is, I say. That's where all the action is. And, you know, I just want to reiterate, I have had the privilege of working with so many families over close to 30 years, and it's listening to the families and the needs of my little patients. I said to my office manager the other day, we missed seeing them in person, which we have been seeing them since the last year, of course, but it's such fun to engage with the kids and the families. So listening to the families, and that was my light bulb moment many, many years ago, and why I started leaving my office and going out into the community to engage with various different organizations, whether it was schools, learning disabilities associations, child development, clinics, all those kinds of things, because health doesn't reside in the office. It is a community set of beliefs. that will bring us all along. And that has been my life's work, really. And that's what I would encourage, as you know, our speakers have been saying, is get out in the community, because that is when we have a collective set of understanding of things and beliefs. That is how we keep ourselves healthy. And so going out into the community, I've been able to, you know, collaborate with so many different organizations to get this information out there with them and learn from them. I've learned the most from my patients, and my little patients teach me all the time, and my parents. It's been such a privilege to have that richness to understand so many different things, or to experience them. So I would say go out into the community, and I hope as a health policy to understand. And I talked about silos. We talk about hospitals, offices. The health is in the community. And the more we can put our policy towards the community, the healthier we will become as a society.
And maybe, Olivia, you could talk a bit about that importance of family and community, especially in places like Inuit communities where those ties have been broken by sending people away to residential schools, by forbidding you from talking your language. How do you recapture that to improve mental health and literacy?
It's happening very slowly. It's taken a long time, but I think my daughter and my son's future as an Inuk is much better than the past. So I have to be hopeful. It's taking a lot of time, but those connections were severed because of relocations, not only to schools. Governments had relocated family and children to different communities, breaking communities apart. When Nunavut were negotiating the James Bay Northern Quebec Agreement with the Quebec government and Hydro-Quebec, this hurt a lot of our families, a lot of our communities, because we had to pick a side now. Do we join the Western, or do we're not going to sell our land. We don't sell our land. So, but these were a lot of things that were not talked about. We just realized that family had been distanced and these things. But I think it's coming back. We're realizing that it wasn't family done on purpose. These things our family is now in the state of forgiving and understanding and trying to get services to help rebuild those, the Residential School Survivors Society, Every Child Matters movement. These things are bringing back pride for Indigenous people. And Inuit, we're like kind of 10, 15, 20 years behind the rest of Indigenous Canada that is waking up. But we're getting there, and I'm trying to build the giants. I believe that Inuit are great giants. They're just sleeping right now. They have been put down, and we're going to build them up. And it's the youth. Our youth population is extremely high. 75% of my people are under the age of 35. So we're a young demographic, and we're trying to fit into, the world says 2 worlds. We're fitting into 3. We have Quebec, the English world, the French world, Quebec, the provincial, the federal, the local. So we're the next generation of Inuit youth are doing good, and we're still facing a lot of challenges, but sharing our realities is what's going to help us find people who truly meaningful want to help us.
Great. And thanks for that message of hope. I think the young people are our hope for the future, and it's great to see that they're flourishing, especially in the North. We have a couple of very specific questions. I'm going to try and send them to hopefully the right person, but if you're not the right person, tell me and we'll put someone else on the spot. Jackie, I think I'll send this one your way. Someone's saying, I'm a tutor trying to help people improve their English. So they have a language other than English as their first language. And they're looking for tips. How can you help me listen to their stories while I correct their English conversation and still keep them engaged? So how do you find that balance?
Listening to the story is connecting with the human that is behind the story. It's validating the story. Validating what's behind the words. I've studied in literature, and when I was studying, it wasn't just about the words. It was about what's behind it, what wasn't even in the book. So what they're telling you is precious. What they're not telling you also. And it's just also understanding that they're sharing. And the best way to connect to the human is to share back. To share back that small story, because it just gets you connected. I give French classes, and the best way that I teach my students to love the language, it's teaching them about how French in Quebec is important. I don't start with grammar. I start explaining to them why they understand a different accent here. And then I go back in history, and then they get passionate and they get curious, and they're like, we want to know more. And because they ask me to tell more of the story, they are listening to me talking in French, and they are learning, they are improving. And I'd also say, whether it's with adults or kids, one thing I really learned being in the educational field is when people tell you that they're not interested, or they're bored, or that's not for them, they didn't understand. I'm going to give you that so much I learned it with kids. I was a teacher before, and I learned it with kids. Kids that tell you, I do not want to do that. It's not that he doesn't want to, he doesn't understand. The same goes with an adult. I've had some adults sometimes being like, oh, yeah, doing this exercises, it's not for me. The topic is not interesting. And then you look at the notebook and it's empty. And then you get to understand that they can't write. It's not that the topic wasn't interesting to write about. They can't. And we don't know who have those skills and who doesn't. So that's really important, to literally just be sensitive and acknowledge that we don't have all that information too. So to just try to grab as much information as we can as we're learning about them. And when we build, that's one of the beauties of Frontenac College, we work on the human connection, and that's how we help them learn. And that's basically why after 7 years, I'm still a volunteer and I'm still teaching some groups, because it's about discovering new humans, new connections every single time I get to class.
Great, a great message. Make it relevant, make it fun, and it's easier for people to learn. Andrew, you're our book person on this panel, so I'm going to send this question your way. Someone's asking if you could send a book to every literacy and basic skills practitioner in Ontario, what would you send?
What single book?
Yeah,
that's a hard question. I think I would have a kind of a long list of books. I think that my real answer is that because there's such a multiplicity of experience out there, we need to really invite people into this space and to find the stories that are relevant to them. And I think that it really is important for us as leaders in this space to really grab that idea and to think more about a library than a single book.
Okay, and maybe you can put some ideas in the chat or in your workshop a little later. You can talk about some more examples.
Absolutely.
Okay, great. Sharon, I think I'll send this one your way. People are asking about people with intellectual disabilities, learning disabilities in particular. How do you help them differently with the literacy, with the mental health issues, or is it different?
Mm-hmm. Well, there is quite a large body of research on teaching kids with, say, low who are lower on the spectrum of learning to understand things. Okay, and they've also done lots of research on whether or not you can learn to read, say if you have a low IQ, and I'm just using that in quotation, that just for just for the purposes of the discussion. They've also done research on if you come from a low socioeconomic or marginalized group, if you are given the right, when we're just talking about reading, we're not talking going on to literary things like writing poetry or more cultural things. Anyone, 95% of people can learn to read given the right techniques, systemic evidence-based structured literacy things. We're talking from kindergarten to grade 3. I'm not knowledgeable about adult literacy, so I'm not going to talk about that. But 95% of kids are able to learn to read effectively and comprehend what they read, given the right instruction. And I would sort of send you back to that Ontario Human Rights report. It has significant amount of information in terms of some of the programs available, so that, and also the research around this. So that would be a good resource for everyone.
Okay. I think, Olivia, there's one specifically for you. People are saying, thank you for that beautiful analogy of the bow and arrow. Look forward, to look forward, you have to look back. They're asking if you know about a model called trauma-informed community building. And if so, do you think this is an important or useful tool?
Yeah, there's a lot of tools that are coming out, and I was sitting in my journalism class and they brought up an article that was written scientifically proving that intergenerational trauma goes to the next generation, and they studied off of war veterans. And it kind of angered me because Indigenous people have been saying this for hundreds of years, but because it wasn't scientifically proven, they didn't recognize it and wouldn't give us resources. So until somebody that is a scientist or, gets recognized, but I'm grateful that these studies are now being recognized, and maybe our stories will be confirmed, and we'll have that space. So we're also looking at different ways of child rearing, because in our traditional culture we call it inuguinik, which really means to mold and build a fully capable human being. And to do that, you need community, you need all of the resources. It's not just your parents, it's about the whole society playing a role in that child's life. So it is good to see peer-reviewed, scientifically published things, but also we have to look back at traditionally our elders' teachings and those things. So we're trying that. We're trying to go back. We're trying to look at traditional spirituality such as shamanism, different traditions we have with childbirth, with, like, I have a Sanayik, I have a Saunik, I have many names. I'm named after many women in different communities, and this builds my support system. But due to colonization, some of these traditions were lost. So it's not about using scientifically proven or peer-reviewed academia to help us, but to allow us to recognize our doctors and our scientists and our ways and bring those back and help and share that with the Western world. So we are looking at different nations. We're looking at all across the world, Greenland with their home rule, and all of these different things. And we're trying to build a positive future, mashing it all together.
Great. A little follow-up in the chat to one of the previous answers. Someone saying a big thank you to Frontier College for their literacy classes, specifically for people with intellectual disabilities. So a reminder that those do exist, and then they are great. Jackie, another question for you, I think I'll send your way. Someone's wondering, do you work with migrants and refugees? And if so, do you have particular tips for doing literacy work, especially that there can be trauma involved there that does lead to the mental health conversation? So any specific tips for working for that high-risk group, I guess we could call it?
I do work with them. We do have two different fields, as I said, but we do have some programs that are literally really about giving services to the people during the immigration and after the immigration, so when they have arrived here, and help them through the process of dealing with everything that has come up or that is going to come up through it. Again, I'd say and I wanted to say this, and I'm glad I have the opportunity, it's about validation. I would give you this either in the mental health, or even on the literacy, when you're trying to teach someone to learn something, it's about validation. And I think like Olivia was saying about it too, when like stories of Indigenous people weren't recognized, it's because you don't get the validation. And when you validate someone's story, when you validate someone not having a skill and being okay with it, that's what I tell people in my training is, it doesn't get the problem to go away, but it just gives the space to new possibilities. The fact that you don't know how to do that. Okay, well, now we have the information. We can see how you can learn to do something else, or something new. It's really about validating the person. Why? Because when you get validation, it becomes true. And that's really important, because it just validates that whether you've been through extreme trauma, or whether your divorce is more difficult because you came to this country with your husband and you came here as a family, as an entity, and now you're splitting up. And this is not just being divorced here, it's being divorced and not having your family and not understanding the legal procedures to get divorced. It doesn't take anything away when you tell them it's okay that you don't know what to do. But now you have the information that they don't know how to do it. And then you can look for the resources, and you can look in them. What are their inner resources that they have, and help them to showcase them, so they can know that they actually have already some tools, that they actually have that information. Some people, when I was giving my French classes, they would come to me and be like, Jackie, I don't know anything and I feel powerless. I was an engineer in my country. And I'm like, how are you telling me you don't know anything when you are speaking to me fluently in Spanish? You have a whole system in your head. The only thing I'm doing with you is teaching you how another system is going to work. But you have learned to pronounce some word. You have learned to read another language. You know how A and L is all. It does the sound. You can process all that information. You are not starting from nowhere. So it's reinforcing to people that you have baggage, and positive baggage. You have knowledge, and you can use it to then build up new skills on it. Oh,
I figured out how to use the mute button after 3 years. Yes. So sorry about that. We're almost out of time, so I want to give each of you a chance to just share some final thought, a take-home message about, we've tackled two really big, important issues, literacy and mental health, and their overlap. So I want each of you to send people, well, not home, but to the breakout rooms with just a take-home message. Andrew, I'll pick on you first. Couple of words for people to ponder on the big picture.
We've been hearing a lot here about the challenges around literacy, challenges around mental health. But as I said before, the space is opening up for more frank and honest conversations about it. We get to be more vulnerable with one another. We get to express ourselves in really fundamentally different ways. And I experienced this with my own kids and their questions to me about mental health, mental illness, substance use, the whole bit. They're just a lot more open. And I think that we need to build on this moment. And that is one of the things that provides me with a lot of hope and a lot of optimism.
Great. Olivia, do you have a hopeful message for us to take home?
Mm-hmm. I feel like the world is changing in so many different parts of the world, and some of it is changing due to scary things. But I think it's about time that we wake up as a human society, and not different cultures or different languages, but as a human that lives on Mother Earth, and how each one of us affects the other, and understanding that. And mental health is not so taboo anymore, and you can share your reality and feel a bit safer to talk about that now. So I think the future for the next generation of not just Inuit, but the next generation of young Canadians, young global citizens is, they say it gets worse before it gets better. So hopefully we're at that stage, and it's going to be a good few years that we will decide we're going to work together in all of our languages and all of our colors and all of our cultures to create a better world for our children. So thank you so much.
Thank you. Sharon, I saw you nodding vigorously there. Can you continue that hopeful message?
Yes, well, as a pediatrician, we look at what we call the ecology, the context, everything, whether it's from generational trauma to social determinants of health. As a child develops, the biology, what you can't come into the world with your genes. And we understand, and what I like, and just on the hopeful note there, is that we are understanding the connections, that all of these things are connected, and to become a healthy person individually and to have a healthy society, we have to stop looking at things in silos. We are understanding how these things are connecting, and so that policy going forward, we will understand that we can't just look at literacy over here in education, or we can't just look at this little bit over here. We are understanding that these things are connected, and that is how we experience, we have our optimal experiences of being a human. So I am hopeful this pandemic has opened up that space of our collective consciousness. So thank you so much for allowing me to be part of this.
And Jackie, you've been positive all day, so I'm sure you'll have a hopeful message for us to finish.
I'd just like to say, the same way I've been pushing on, do the little things, start with you. You're part of such a bigger thing. You're part of a network. You have some people around, you have some families, you have some friends. And if you start doing the small things, it's going to have a greater impact around you. It's going to change stuff because you get a bigger perspective, and then you can share about that bigger perspective. And I don't know, I've just been really hopeful because I've seen it around me, but then you get to discover that there's a lot of great people around you that are willing to do the job with you.
Great. That's wonderful. So I want to just say what a privilege it was to participate, to get to ask you, all you very smart, eloquent people, questions today. I want to remind the audience, please stick around to go to the breakout rooms, not break up. And we're going to take a 10-minute coffee break, a virtual coffee break. You can do whatever you like during that time, and then come back about 2:40, so in about 10 minutes. After a little breather, and have a more in-depth, more intimate conversation in a smaller group. The links were provided to you in the reminder email this morning. If you can't find that, if your mailbox is constantly overflowing like mine, just check the chat. We've just put the codes there where you can click on, and you can copy and paste them into your browser. If you speak French, there will be some translation. There will be a French staff member in each of the groups. Alors, pour les francophones, il va y avoir quelqu'un de francophone dans chaque groupe. Pas de traduction simultanée, mais quelqu'un qui peut traduire sur vous si vous voulez. And these breakout groups, a reminder, they won't be recorded. Yes, this session was recorded. There were a couple of questions. You can access it later. We'll send all the people who registered a link. But the breakout rooms will be more off the record. Nothing will be recorded. You can speak more freely. So again, thank you so much to our panelists, Dr. Sharon Burry, Olivia Ike Duncan, Andrew Johnson, and Jackie Garcia Navidad for their wonderful contributions. Thank you, of course, to our funder for this event, the Government of Canada's Adult Learning, Literacy, and Essential Skills Program. And to the audience, thank you for the wonderful work you do, for the rich discussion you had, and I hope it continues in the next few minutes. And thank you again to Frontier College for all the fabulous work they do. I look forward to helping out in the future at future events. So take care and have a little break and come back for more.